This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: What is glycogen storage disease? Answer: Glycogen storage disease is a group of genetic disorders that affect the body's ability to store glycogen. Question: Can you name some of the types of glycogen storage disease? Answer: Yes, some of the types are von Gierke disease, Pompe disease, Cori disease, Anderson disease, and McArdle disease. Question: What are glycogen enzymes? Answer: Glycogen enzymes are a group of enzymes involved in the synthesis and breakdown of glycogen. Question: Can you name some of the glycogen enzymes? Answer: Yes, some of the glycogen enzymes are UDP-glucose pyrophosphorylase, glycogen synthase, branching enzyme, Debranching enzyme, glycogen phosphorylase, Debranching enzyme, and amino 1,4-glucosidase. Question: What is the role of UDP-glucose pyrophosphorylase in glycogen metabolism? Answer: UDP-glucose pyrophosphorylase is an enzyme involved in the synthesis of glycogen by converting UDP-glucose into glucose 1-phosphate. Question: What is the function of glycogen synthase? Answer: Glycogen synthase is an enzyme that synthesizes glycogen by adding glucose molecules to a chain of glycogen. Question: What is the role of branching enzyme in glycogen metabolism? Answer: Branching enzyme is responsible for the creation of branches in the glycogen molecule, allowing for efficient storage and quick release of glucose. Question: What is the function of debranching enzyme? Answer: Debranching enzyme transfers glucose residues from a branch of the glycogen molecule to another part of the same or a different glycogen molecule, allowing for the efficient release of glucose. Question: What is the role of glycogen phosphorylase in glycogen metabolism? Answer: Glycogen phosphorylase is an enzyme involved in the breakdown of glycogen into glucose molecules by breaking the alpha-1, 4 linkages between the glucose units. Question: Can you explain the function of debranching enzyme? Answer: Debranching enzyme is responsible for breaking the alpha-1, 6 linkages in glycogen, allowing the release of glucose units from the branches of the glycogen molecule. Question: What is the role of amino 1,4-glucosidase in glycogen metabolism? Answer: Amino 1,4-glucosidase is an enzyme involved in the final step of glycogen degradation, breaking down the alpha-1, 4 linkages between the glucose units in the glycogen molecule and releasing glucose. Question: How does glycogen storage disease affect the body's ability to store glycogen? Answer: In individuals with glycogen storage disease, there is a defect in one of the enzymes involved in the synthesis or breakdown of glycogen. This leads to an accumulation of glycogen in the liver, muscles, or other tissues, causing various symptoms depending on the type of the disease. Question: What are the symptoms of von Gierke disease? Answer: Symptoms of von Gierke disease include low blood sugar levels, growth retardation, liver and kidney dysfunction, high levels of glucose in the blood and urine, and a fatty liver. Question: What are the symptoms of Pompe disease? Answer: Pompe disease is a form of glycogen storage disease that affects the muscles. Symptoms include muscle weakness, enlarged heart, difficulty breathing, and delayed motor development. Question: What are the symptoms of Cori disease? Answer: Cori disease, also known as glycogen storage disease type 3, affects the liver, muscles, and kidneys. Symptoms include muscle weakness, muscle pain, and liver and kidney dysfunction. Question: What are the symptoms of Anderson disease? Answer: Anderson disease, also known as glycogen storage disease type V, affects the liver and kidneys. Symptoms include liver and kidney dysfunction, low blood sugar levels, and growth retardation. Question: What are the symptoms of McArdle disease? Answer: McArdle disease is a form of glycogen storage disease that affects the muscles. Symptoms include muscle weakness and cramps during exercise, as well as fatigue and muscle pain.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.